Hi everyone, good morning to all. I am Prof.Manavalam working in SNS College of Nursing. Now we are going to see yet another topic in antepartum hemorrhage, that is abruptio placenta. In previous topic we discussed about the reason of APH, that is placenta previa and abruptio placenta. We see in detail about the brief about the placenta previa. Now we are going to see about the abruptio placenta. Abruptio placenta, it is one of the another cause of APH, antepartum hemorrhage, but it is when compared with the placenta previa, it is a rare condition, and also when compared with the placenta previa, it is somewhat comparatively it is complicated one. So abruptio placenta means the placenta normally it will be separated at the time of second stage of labor or before starting of the at the time of second stage of labor only it is starting to separate it. But in case of some other condition, it may be get separated prematurely, that is called as abruptio placenta. Premature separation of the normally located placenta is called as abruptio placenta. It may be before 37 weeks of pregnancy or before starting of the labor. The separation may occur in three different ways. There may be a marginal separation or central separation. So in marginal separation, the placenta start to separate marginally. In central separation, it may be a complete separation. It may be a complete separation or partial separation. In central, sometimes part of the placenta it will be getting separated. It causes part of the blood which will be getting out from the internal os. Some of the blood which will be getting collected and forming as a retroplacental clot. Complete separation means completely it is getting separated by central method, but it does not exit out. The blood doesn't exit out, so it will be forming as a hematoma. There are two types of placenta previa, revealed and concealed. Already I said the placenta may be getting separated by parts marginally or centrally. In case of if the placenta which will be getting separated marginally means it started to separate from the below means automatically the bleeding when it is detaching from the uterine part, the bleeding from the maternal circulation which will be moves out. So we can see bleeding outside. Visibly we can see it, that is revealed. In case of concealed, it is present in case mainly in central separation, central placental separation. So in that the placenta which will be getting separated centrally, so the blood which will be collected between the placental membranes and the uterine cavity, later it is forming as a retroplacental clot or hematoma. So it is one of the complicating one when compared with the revealed variety. How we have to manage the abruptio placenta cases? So most of the abruptio placenta cases, the mother used to have the abdominal pain, visible bleeding may be present. In case of concealed hemorrhage only, it is very difficult to diagnose and start the early management and save the life of the mother as well as the fetus. But in revealed type, it is somewhat easy to find out the diagnosis and early manage. We can start the early management. If we receive the cases with abruptio placenta means immediately we have to do the general and abdominal examination. We have to monitor the fetal status by putting the mother under CTG, and we have to know about the grade of placental abruption. There are three grades are there: 0, 1, 2, 3. In 0 there is no visible blood loss, and also mother doesn't have the symptoms abruptly, but doesn't have any kind of symptoms. But in grade 1 the mother may have the slight bleeding, but the symptoms of shock is absent. But in grade 2 the mother may have the mild to moderate amount of bleeding, and also minimal symptoms of shock is present. But in case of grade 3 the blood loss is higher, at the same time the mother experiencing the symptoms of shock. So we have to know about the grade of abruption. Based upon that we have to immediately start to give the management to the mother. Next, basic blood investigation we have to do, and the coagulation profile monitoring is very much essential in this condition. If the mother is in grade 3 means we started to give the resuscitation procedure to the mother. At the same time certain emergency measures we have to have that. So we have to infuse the crystallite solution in order to stabilize the mother condition hemodynamically, get ready for the blood transfusion. Periodically we have to check the coagulation profile, and we have to monitor the urine output and fetal monitoring by either by NST or CTG. After doing the resuscitation procedure, next we have to know the types of abruptio placenta. Either it may be a revealed or concealed variety. But in case of revealed variety, again we have to check about the mother condition, whether the mother is in labor pain or mother not in labor. But the mother is having the symptoms of labor means, true labor means, better we can take the mother to the labor, and we start to do the artificial rupture of membrane, start to infuse the oxytocin. We have to monitor the progress of labor. If the progress is good enough means we can deliver vaginally. Following that also we have to administer oxytocin in order to improve the uterine tone to prevent the PPS, postpartum hemorrhage. But in case of revealed invariety, the patient doesn't in labor means we have to we should not wait until make the mother experiencing labor. Better we have to start to give the artificial rupture of membrane and start to infuse oxytocin. This is one kind of induction method of artificially inducing the labor. We have to monitor the progress of labor, deliver the baby vaginally. If the progress is not good enough, the mother having the associated complicating factor, the fetus condition also not reassuring, better we can deliver by cesarean delivery. But in case of concealed variety, again we sometimes we can go for vaginal delivery, but most of the cases they will take the mother to cesarean delivery, because there is a higher chance of fetal distress, maternal hypovolemic shock. In order to save the life of the mother as well as the fetus, better we have to take we have to first stabilize the mother by IV fluids administration and blood transfusion. Then we have to, after stabilizing, immediately we have to take the mother for cesarean delivery. So this is the management for abruptio placenta. Thank you all. I hope everyone understood about the APH and its causes very well. Thank you all.